as classrooms come back to life this Wednesday and the 2026 academic year opens its doors. Millions of children will be putting on uniforms, packing school bags and carrying emotions we cannot always see. Behind the smiles on the first day excitement, many young people are quietly facing anxiety, depression, fear and pressure, often long before they have the words to explain it. So in fact, many mental health challenges begin before the age of 14, making schools not just places of learning, but lifelines of support, safety and early care. So this afternoon, we'll focus on the heart of our schools, the mental well-being of our children. And of course, asking the question, how do we create supportive environments? How do teachers, parents and schools work together to spot the early signs and respond with compassion and not silence? So we'll be unpacking this conversation and joined in a moment by Dr. Benedict Mhlongo. Right, a very good afternoon to you. Thank you so much for your time. As the 2026 academic year gets started, there are a lot of emotions, right? And as you try and get a sense of what the most common warning signs are that a learner may be struggling mentally or emotionally beyond the anxiety of just starting school or starting a new school, or perhaps just regrouping and beginning a new academic year?
Sure, great question again. I think it's very important for us to understand that I think there's a lot of dynamics that comes into that as well. Specifically, you find that children actually are repeating a grade. There's a lot of, anxiety that they face or feel closer to the time where schools now need to reopen. They don't play with other kids. There's no appetite, there's insomnia, there's a lot of challenges that they actually face. So I feel like there's a lot of warning triggering factors that can actually tell to the severity of how they are feeling or what sort of feelings or issues they are faced with at that time. But number one is anxiety. They're very anxious. They're feeling somehow.
So many mental health conditions begin before the age of 14. What are some of the early warning signs that teachers and parents should be looking out for at such a period?
Yeah, that's specifically spot on. It's always before age 14 as well. So I think it's very important for parents, specifically teachers, that spend most of their time with the learners. Could be anything around their anxiety. It could be sweaty palms. It could be them overthinking. It could be them actually feeling inadequate in terms of the class or learning environment. So it's important for teachers as well to actually shop around in terms of where the proximity, where children actually sit, or learners, as well as parents. I mean, the closing of doors, the closing themselves, feeling very recluse or not involved in the family. Those are also the other warning signs that we can actually do in terms of to assist children to actually feel part of, the home environment or the school environment. But them isolating themselves, feeling very anxious, feeling that they don't believe in themselves, feelings of self-worthiness as well, not feeling like they can contribute to the greater society. Those are all, specifically for me, the most important warning signs that we actually need to detect and intervene at that time.
And it seems that anxiety among learners appears to be rising, with the many factors being influential, like social media and others. What are the most common causes you see in schools today in really assessing the trends that we've come to see?
I think it's most importantly, it's around them wanting to belong, number one. Remember, they're coming from a developmental stage where anything and anything is important that is actually outside. So at home, specifically the parent or the parents in the household, they don't matter in terms of their own distinguishing factors or them trying to actually assist. So what normally is important for them is actually what is said outside. So the key factors for us to actually see there is that they want to be seen, they want to belong, they want to be made to feel like they are contributing to a greater sense of the particular community. So those warning signs could be around anxiety, could also be depression as well. Remember, anxiety and depression happens on the same spectrum as well. So it's important to see that, for instance, anxiety asks the question, what if it doesn't work out? Whilst depression is saying that, what if they don't like you as well? So it's around how you are feeling in terms of yourself. Also, what are you thinking in terms of your whole overall self-efficacy as well.
We've seen the impact over the years in the number of stories that have been covered by the media on the impact of bullying on young people in schools and homes. How does bullying, both in person and online, impact a child's mental health and self-esteem?
That's quite a severe one, because it does, affect them to a sense of their own confidence, self-worth as well. They feel that they are not actually seen or noticed. They feel like there's a sense of not love or not being accepted. So bullying is an act where, the child is actually forced to do certain things that are not, want to actually do. Could also be physical, could be emotional, could be one that is actually quite mental, where the child will be isolated. So bullying is the highest predicting factor, especially that I've actually noticed during my interventions around schools, that predicts the likelihood of them thinking or contemplating suicide as well. So bullying is definitely a factor where then children will lead to actually having to have such thoughts as well. So bullying is not a good one. We need to do much work in terms of actually creating awarenesses in terms of schools as well.
Do you think that there may be some significant challenges in the amount of work that needs to be done? Because one also has to consider the importance of teacher training in mental health awareness and what should that training essentially include?
Yeah, great question again. I think for me, it's important to also acknowledge that the government is also strained. Government is also overwhelmed. I think it also speaks to a lot of factors around budgeting and finances as well. But in terms of training or workshops around teachers, very important for them to be trained around sensitivity, conflict issues as well, in terms of how we challenge and assess them. And also just to be able to try and assess or be able to pick up the distinguishing factors or early warning signs as well. So training is quite key for the teachers, but I know now there are certain programs, especially in education, where they have access to psychology as well. So I think it's also quite key in terms of there is a budgeting, constraint or factor or the government feeling overwhelmed, but I think there's much more that we can do in terms of actually creating awareness and also equipping our educators as well so that they can be able to see early warning signs, have a system in terms of the school where we can actually do a tryout where there's actually an education psychologist or clinical counseling that is actually in-house in the school so that parents and children can also be kept intact as well. So whether it's monthly check-ins, weekly check-ins, for instance, if a child is not performing well, maybe let's rotate the child to see a person who was actually trained in the mental health capacity as well. So it's very important to see that because poor performance is also another sign. Could be bullying, could be issues at home, could also be them not feeling that they can actually, ascend themselves in the schooling environment. So definitely training can actually be a system or great of assistance as well.
And very lastly, before we let you go, it's one thing to say ask for help, but intervention does sometimes require a great deal of money. What advice do you have for people who are merely looking for help without necessarily having the funds to do so, but showing some concern in their children?
I think that's a great concern also you're touching on, because I remember, anybody who can afford a psychologist or mental health is also seen as a class predictor as well. You then belong to a particular class, but also mental health is quite, prized into the higher degrees as well. So it's very important to understand that there is access to clear, proper mental health in terms of your clinics, hospitals, that is actually free. And also there's a lot of awareness that is actually there. People would normally DM me, people also assist and encourage them as well. There's a lot of shows now that we see on TV that speaks to such that a person, even as much as they may fear coming out or reaching out, but there's also that help that you can actually get in a very private type of matter. But also in terms of access, there's definitely is access in clinics, NGOs, NPOs, as well as hospitals. They do offer amazing mental health as well at a particular free rate as well.
Thank you very much. Of course, wrapping up that conversation, some sound advice there that mental health should indeed be taken seriously as the 2026 academic year gets to a start. Speaking there to psychologist Dr Benedict Mhlongo, giving us a sense of advice and, of course, some ways to navigate around these pressing challenges as young people start the new year.